So I'm Lincoln Sheets. I'm an assistant research professor in the Department of Health Management and Informatics, which is part of the School of Medicine at Mizzou.
All right, perfect. Thank you. And then another hard question. What do you research? Just real general.
Yeah, I work on applying artificial intelligence and big data to population health. So looking at big patterns of who gets sick and why, and how can we predict who's most likely to need hospitalization.
All right, excellent. And how long have you worked in this field?
I have been studying this for about 10 years. I started when I was in med school and got a doctorate in informatics at the MUIDSI here at Mizzou. And then I've been on faculty for about 4 years since I graduated.
All right, excellent. And then what made you want to get involved with this work or the lab you're in right now?
Yeah, well, when I was a software engineer for 20 years and then left that job to go to med school, and I thought I was going to be a rural primary care doc. But when I got to med school, I started learning all the exciting things that people are doing with computers and artificial intelligence and data analytics in medicine, and started getting involved in that. And that's why instead of practicing medicine, I went on to get an MD PhD, and now I do research and teaching full time.
Excellent. And since you were in software engineering before, tell us a bit about your past research and how it applies to what you're researching now.
Yeah, so my software career was in insurance and banking and finances. So lots of data that's very different from medical data. Different laws apply. It's gathered and grouped in different ways. But insurance is all about predicting risk. And that's what insurance companies need software to do. And so a lot of what I learned in insurance really applies to medicine. Medicine for an individual is about going to the doctor when you get sick, going to the surgeon when you need surgery. But at a system level, or at the level of the state of Missouri or the Boone County Public Health Department, it's a matter of figuring out who's going to need help, where do we take sex education in the schools, where do we do diabetes screening, where are the neighborhoods or the employees of which industries really need that kind of follow-up and education and screening, so that we're taking the healthcare to the people that need it most before it gets out of hand and they have expensive and life-threatening health problems.
All right, perfect. So now we're going to move on just a little bit to touch on summer programming.
Yeah.
And, get a little diversity in our questions here. What made you want to get involved with our summer program, and what made you want to be a mentor?
Yeah, I love working with students, and the students that apply and are accepted into the summer research internship are the best students. During the school year, I work with lots of grad students, and of course they're sharp and terrific people and have great ideas. But lots of times when I'm working with undergrad students, they are also so sharp. The kind of undergrad student that wants to do research, that's an exceptional person. It's the same with the kind of people that do the summer research internship. Those are people who have a real passion for research. All the summer research interns that I've mentored so far have been from overseas, and they've all come with a real understanding of the particular health challenges in their country or their community. And they've come with a lot of ideas, and I've helped them form those ideas into what kind of research needs to be done, and at the same time can be done in a single summer. What can we do with the resources and the time we have that can make an impact?
Excellent. And that's I believe, Dr. Mosa.
Yeah.
So it said something very similar. That
Is
was
that
a big
right?
challenge that he was working with.
Right.
Getting meaningful research that can actually be done in 2 months.
Exactly.
Compared to 3 years or whatever you get
Right.
your average year.
Right.
All right, cool. So, I ask this to the students, and I like to ask this to the mentors as well.
Yeah.
What's something you hope to get out of your experience this summer as the mentor?
Well, as a mentor, every year, and this year's not going to be any different, every year as a mentor, I learn a lot just by watching over my students' shoulders, my interns' shoulders. You know, these are really sharp people that are doing really high-level research, and they're doing it on topics that are a little different than mine. I feel like I'm qualified to mentor them because our methods are similar, and we're all working in kind of the broad field of public health and public health informatics. But when Anya, for example, brings 2 or 3 studies that she's doing this year alone on the topic of antimicrobial resistance in Zambia, where she lives and is studying, that's a whole field of study that I knew almost nothing about before I started working with her. So I learned so much from her expertise and from the expertise of all the interns I've worked with. And it's really inspiring. These young people work so hard and bring so much intelligence and passion and meaning to what they're working on that it's a pleasure to help them, to be a part of their work.
What are the benefits of getting involved in research that you've seen from, like, the benefit for students is what I'm asking.
Yeah. Well, on the practical side, anytime you're applying to the next stage in your education, if you're going to grad school or if you're looking for a paid internship in a corporation, or if you're in the job market, if you have research experience, that really sets a few students apart from all the other people that are applying for their jobs. If you have a publication, that's really impressive to employers and especially impressive to admissions committees at graduate schools. And then aside from that, I think the intangibles are, when you do research, you really understand how science works. You understand the limitations about what science isn't, right? No single study is the last word on a subject, right? There's always new science. And there's always more questions. Every hypothesis that's tested and shown to be true or false brings our knowledge forward, but it always raises additional questions. Why does it work that way? What are the situations where this is true and situations where it's not true? And interns and students really absorb that, really integrate that into their understanding of how science works, how academia works, and how the world really is. I think that's really valuable.
You were working in the financial sector before.
Yeah.
What excites you the most about medicine? Just researching anything about it.
Yeah, that's a great question. I really liked my job at the insurance company. I worked at an insurance company in my hometown for 20 years, and software engineering is kind of like doing puzzles for a living, right? You write the code and you test it, and it's either right or not, and you keep going until It's completely perfect. And I really liked the people that I worked with. I worked with terrific bosses and coworkers. But working for the insurance company, I didn't always feel like I was one of the good guys. When I got up and went to work in the morning, I felt like, I'd like to be making the world a better place. Insurance is a great thing, and the world is a better place because we have insurance. But that's really what made me want to study medicine and to work in medical research.
Sweet, thank you. So, what do you believe to be some of the most pressing health issues today, and why?
That's a great question. I think that in the United States particularly, but all around the world, access to healthcare is a big problem. Inequality in healthcare. And Martin Luther King said something about inequality in healthcare as one of the great injustices in our world. How to solve that problem is really tough because you can't just say everybody gets the same healthcare, right? It is a limited good. We can't say we'll just legislate more health care for people that need it. So the people that provide health care, like Mizzou Medicine and Mizzou Hospital, are increasingly in the business of figuring out how to provide health care not just for a fee for service, not just this is how much it costs to do a surgery, and the more surgeries I do, the more money I make, and only rich people and well-insured people can afford them. Hospitals and academic hospitals and states and countries all over the world are doing a lot of thinking these days about how can we do more preventive medicine? How can we look at who's going to need healthcare, who is most at risk of diabetes or heart attacks, and what can we do at lower cost earlier to help those people so that they're not stuck between needing expensive healthcare that costs a lot of money and only the rich can afford, or just not having access to healthcare for the poor.
Okay, what made you want to get involved with using big data to identify chronic conditions and future health outcomes?
Yeah.
And how do you use big data sets?
Yeah, that's a great question. Big data means a lot of things, and in healthcare there are some particular sources of big data like hospital records and Medicare claims for thousands of people, hundreds of thousands, millions of people. And there's new sources of big data like Fitbits and smartphones and soon smart toilets and smart refrigerators, that will be connected to the Internet of Things and will be telling somebody, maybe my doctor or my hospital or somebody, whether my urine is normal today or whether I'm eating those fruits and vegetables that are in my fridge. And of course there are privacy issues that we have to balance with all that. But the amount of data is just growing exponentially, and the job of data analysts and data scientists is to figure out how to gather that data and find the patterns in it that doctors and nurses and public health policymakers can use. And when I was finishing med school, thinking about doing a family practice residency and also thinking about doing a PhD in informatics, a good friend of mine was talking about that decision with me, and she said that I would probably help more people doing research than I could ever help one at a time as a physician. And that really helped me decide on my career, and really I think is an example of the power of big data. Not just the data about one person and comparing symptoms and lab results with a textbook to diagnose one person, but looking at the big patterns, looking at how the environment and poverty and education and all these big forces in our lives affect healthcare outcomes for millions of people.
All right, excellent. And this might tie into the previous question just a little bit, but what would be like the big question you want to answer with your research, or the big solution you hope to find?
Yeah, I'd say right now, this year, for the next 5 years, as far as I can see, the big question that I'm working on is what are the most important, the phrase that we use in my field is social determinants of health. What are the things that make one person's likelihood of getting sick different from another's? There are people in this building, people right in offices nearby us right now that are working on genetic determinants of health. And we're finding out more and more about how important that is. But I'm more interested in social determinants of health, partly because those can be changed by law, by economic policies, by outreach programs and screening programs. Genetics are hard to change. Knowing the genetics is so valuable because that means that a doctor can know whether this drug is going to be more useful than that drug for me. But if the doctor knows my education level and where I live and whether I'm rich or poor, that's going to tell her or him a lot about how to educate me in taking care of my own health. And that's what I want to contribute to.